Welcome, friends. Hi, this is Dr. Jaitly, your cardiologist on MuniMeterHealth, your source of learning cardiology and about human heart, illness, and obviously wellness. So welcome again on MuniMeterHealth. Briefly, we're going to be talking about today what are the beta blockers, what's their role, and specifically so in electrical storm. Well, these are some of the newer terms that some of the students will be interested in, but I'm sure the colleagues are well versed with it. But just to refresh them very quickly in this video, well, understand one thing, that beta blockers have a great anti-sympathetic activity, as we all know. Now, electrical storm normally occurs in a setting where you already have an ICD. Here I'm drawing. Let's use another color code here, perhaps. Yeah, so this is the ICD that's being placed into the right ventricle in this fashion, if you will. And obviously there's a coil here, and there's a coil here. And then now ICD, if you have a CRT, obviously that's going to the coronary sinus venous, coronary sinus. So you have another lead, in other words. But the whole idea is wanting to see if you can defibrillate at the time when the VT occurs. Okay, now most of these patients who have an incessant, we call it, that means several episodes per 24 hours, and that's called incessant VT, and that's what electrical storm is. So in these patients, an ICD is already in place or will be indicated. So once you indicate an ICD, despite the fact they have an ICD, the VTACs are still happening, and because these VTACs are happening from originating in whichever ventricle, whether it's in the RV or in LV, wherever they're originating from, the defibrillator will defibrillate those VTACs and terminate those arrhythmias, so this way the life goes on. But the whole idea is wanting to see, can the VTACs be lessened? Obviously, can they quickly subside? And so one, in less in frequency, okay, and can they be less severe, in other words, less in duration, if you will, okay, or less symptoms, and then a quicker discharge. Obviously, these patients who are being admitted for ICD placement and electrical storm, they can have a quicker discharge rate. So rehospitalizations and hospitalization rates or durations can be lessened. So there was a study that was done where they did about approximately 60 patients, and all of them, they had an ICD, and they randomized them into two groups. One, by the way, each of these groups received amiodarone. Now, you know that's a very powerful antiarrhythmic drug for VTACs. Okay, so here we are on the right side of the panel. So you have amiodarone on both arms, and these are all ICD patients, are roughly about 60 in number. And one group received propranolol, the good old-fashioned propranolol. Remember, that's a non-selective beta blockers. Okay, so it's a non-selective beta blocker. Now, the other group received metoprolol, which has obviously been around for a while, but the fact is that's more recent, and it's obviously a beta 1 selective beta blocker. So it's a beta 1 selective beta blocker. So this is a non-selective, which was the original propranolol, a beta blocker that came out. They found, in fact, the amiodarone patients who received propranolol round the clock, say 40 milligrams Q6 as opposed to 50 milligrams Q6 of metoprolol, these were the patients actually they had a decline in the electrical storm rather quickly. So all the parameters that we just discussed, lesser in frequency, lesser in duration, and a quicker discharge, and of course the VTACs subsided rather quickly. So all of these were positively happening in propranolol group as opposed to the metoprolol group. In fact, some of these patients, if you look at statistically, significant numbers were seen where almost 27 out of 30 patients who were randomized on propranolol, they immediately reverted back to normal sinus, and the VTACs had been terminated much earlier. They may have been terminated in less than 6 hours as opposed to in more than 24 hours, still requiring for metoprolol group to act on. So the clear indication was that beta blockers in electrical storm do work. Obviously both work, but propranolol was working even far better than the metoprolol group. Okay, so this short video basically highlights the role of beta blockers in the electrical storm in a setting where ICD patients already have a defibrillator in place, and despite that they are having these incessant VTACs, but beta blockers, especially propranolol, which is the original beta blocker, works better than metoprolol. Okay, so hope you enjoyed this small little short session and a quick lesson here, and looking forward to meeting you again on my MuniMeterHealth. Stay tuned for more newer trials and newer happenings. Okay, good luck and best for your exams. This is Dr. Jaitly again from New York on MuniMeterHealth. Bye.